Hi guys, we're going to be going over the oxygen administration via non-rebreather mask. So like always, we want to start with PPE, personal protective equipment. So we want to make sure we gather all the right supplies. I'm going to be using my water bottle as a fake tank. Now, so first of all, we would want to crack the valve. Make sure we let any dust out. And then we want to go ahead and place the regulator. So make sure we hook that on there snugly. Then we're gonna want to open the valve so we could give it a full turn. And after that, we're gonna check for any leaks. And we're also going to check the tank pressure, which should be at around 2000 PSI in a full tank. And once that is done, we're gonna go ahead and place our non-rebreather mask on the correct port on the regulator. And after that is hooked up, we want to open the valve so we could pre-fill the bag. So we want to make sure that the bag on the non-rebreather is pre-filled. And after that, we're going to want to adjust the regulator, put it at least 10 liters per minute. And once that is done, we're just going to place the mask on the patient and place it on there snugly. And once that is done, that should be it. Thanks. Hi guys, my name is Jose. I'm an EMT student. So we're going to be doing the BVM ventilation mask to an apneic patient. Alright, so like always we begin with PPE, personal protective equipment. Following that, we're going to make sure if the patient is responsive. So are you okay? Are you okay? If the patient is not responsive, then we're going to go ahead and request additional EMS. After that, I'm going to check for a pulse and breath simultaneously.
The patient is unresponsive, apneic, and has a weak pulse of 60.
Alright, so next we're going to go ahead and check the airway. So I will open the airway with the head tilt chin lift.
The mouth is full of secretions and vomits.
Alright, so since the airway is not padded, we're going to go ahead and get our suction device. Make sure we have the right catheter, the suction catheter. So we're going to go ahead and turn on our suction device. Then we're going to insert the catheter in the mouth, making sure that we only suction as we're pulling it out, never suction as the catheter is going in. And in an adult patient, we only want to suction for 15 seconds at the most. And after we're done with all of that, is it clear?
The mouth and oropharynx are clear.
Alright, so once that is cleared, we're going to go ahead and manually open the mouth or use a tongue depressor to make sure that our patient does not choke on his own tongue. Then we're going to go ahead and insert it in the OPA. We want to insert it at a 90-degree angle, but before that we want to measure from the corner of the mouth all the way to the earlobe. And then once we have a right fit, we're going to go ahead and insert it sideways at a 90-degree angle. And as we're putting it in, we're going to make sure to rotate it into the correct position.
No gag reflex is present and the patient accepts the airway of drink.
Right, so if the patient accepts the airway, we're going to go ahead and get our BVM and put it on the patient. And then provide breaths or ventilations every 5 seconds. Alright, so we're going to do this for at least 10 to 12 per minute.
The ventilation is being properly performed without difficulty.
Alright, so now we also want to go ahead and connect our gas tank and go ahead and connect it to our BVM. Alright, so while we provide ventilations, we're also going to be administering oxygen at least 10 to 15 liters per minute. Okay, and I think that should be it.